All right. Hey, gang. Welcome to the GBNO show, episode lucky 13. I'm Dr. Rob. That's my awesome wife, Shannon.
Hello.
So the background on what we do, chiro, rehab, strength and conditioning, get you better from the outside in. Shannon.
Anything cellular from the inside out, disease prevention, weight management, all of the above.
So we are your Get Better Not Older team from the outside in and the inside out. Why should you listen to us? You should listen to her because she's smarter than me, but I know a couple of things. But what I will say is over 50 years of combined experience being clinicians, actually seeing patients, not just going, hey, this paper now shows this. We've been seeing patients, so we see real world, and we're going to bring real world to you. Anything to add?
Perfectly said. No. So, hey, Dr. Rob, I feel like lately our topics have been very nutrition focused. Mm-hmm. Today is your day to shine. You want to know why? Because we are talking all things back pain.
Yes, let's go, baby. This is me.
This is all you.
Won't you just leave the room? I'll take care of this.
All right. There are a few things I could add.
Go have a smoke break.
Right. Why don't you get this party started?
Okay, so why do we talk about this? We come up with our topics based on our discussions, based on questions from patients, questions from followers. And this time of year, like we talked about, and I can't remember if it was the last podcast. No, it was 2 podcasts ago about getting better, not older, and maintaining health while we're into the holiday season. One of the things I see clinically very commonly is people forget about fitness routines. People forget about diet routines. I even hate to say diet, but they forget about their normal lifestyle goodness, okay? Like what they should be doing and what they normally do, but they go, hell, it's the holidays, I'm going to do whatever. Well, what I see clinically in my world is I see an uptick in lower back pain because people are picking up boxes. They're sitting on the floor, bent over, wrapping presents. They're just doing things differently than they would normally do. They're going up to their attic or going down to their basement to pull out the artificial Christmas tree. They're getting on a ladder to put up lights. So
I have one.
You have one what?
Which is not anything we are ever going to have to deal with ever again living where we do, but snow.
Yeah, shoveling the driveway. Remember I told you when we bought our house in Florida, it's got a pretty big driveway. I remember thinking when we walked up to it with the realtor, I was like, ooh, this is going to be a pain in the ass to shovel. And then I went, hold on a second. There's no snow in Florida. Well, I don't think there has been in 30 years or
if
something.
If there is, it's gone in an hour.
Yeah, not shoveling that driveway. But yeah, so let's jump right into it. Let's categorize it, okay? We know in my world, you're going to have 2 types of back pain. Microtrauma, which is an accumulation of bending over the wrong way, bending backwards the wrong way, moving in a certain way that your back doesn't like. It pisses it off. Things get tight. Things move. Things seize up. Things spasm. Builds up into an acute event where, oh, I just hurt my back. Or you wake up one morning, you're like, oh my gosh, my back's really tight. What's going on? I don't know what's going on. That's your cumulative trauma or microtrauma. Little bit, little bit, little bit, little bit, little bit. That adds up. Boom. Now you got a back issue. Or your macro trauma, which is you're on your ladder, you're putting up lights, and you fall off, and God forbid you hurt your back. That's a macro trauma, okay? Football player, a fall, okay? Those are your big, macro meaning big, okay? Now, most of the time, it's the micro trauma that's causing the issue. So somebody is down in their basement. They're rummaging through all their stuff. They're bent over, looking under a shelf, and they go, oh, there's the Christmas tub or the Christmas tote bin or whatever. What do you call them here? Totes, right?
Bin.
I call them bins, but I know some people here call them totes. You find your Rubbermaid bin or tote, and you go, oh, sweet, there it is, and you bend over to look through it, and you're probably not paying attention to your back positioning, and you're in a weird, twisted, flexed position, and then you go, oh, that's good. Put the lid on, set it aside. Do it with the next bin or tote. Then you got the big Christmas tree box that's really heavy, and you should probably team lift it with your significant other, and you don't, and you just pick it right up and and lug it up the stairs if you have a basement, or downstairs if you had an attic, or like us, have a storage facility where we got to pick it up, load it into the car. All of these things, if you're not doing them correctly, cause microtrauma. And if you're lucky, that microtrauma doesn't snowball into something big. Most of us over the age of 40 have already had some sort of incidents with the lower back. So you've already got a little hail damage, a little weak spot, a little bit of an unstable spot, a little bit of a disc bulge. That's just kind of the sleeping giant that you're not trying to wake up, but you do wake up and then bam, you've got an injury.
Well, and I think too, it's nothing to do with even this time of year. It's people don't realize that perhaps the way they're moving through their day, each step of the way is causing little micro traumas. In other words, like I know you've talked to me about brushing my teeth, and because I don't have a great low back, how I get into the car, how I get things out of the dishwasher, or how I get things in and out of the laundry, all of those things, which in addition to the busyness of this time of year, you still have all those that exist as well.
Plus you're adding in way more bends, way more twists, way more rotations. Now, there's this school of thought out there, okay, because there's some research that shows, yes, your spine is designed to bend and designed to twist, so you should do it. And there's a lot of pushback in the world of, there's some physical therapists, some other influencers. Well, when I'll post something about using spinal hygiene, which is really what we're talking about now. Spinal hygiene is what I adhere to because I was born, just like you were, with what we call a normal variant, okay, which means, well, I'll tell them, both Shannon and I are akin to each other in many ways, but we were both born with something called the lumbarization of the sacrum. So the sacrum is that triangular bone that's at the bottom. So you have L5 and then you have the sacrum. Between L5 and the sacrum, you have a disc. That's one of the most commonly bulged discs in weightlifters. Above that, L4-5 is the most commonly bulged disc in the normal population. The sacrum is fused when we're in utero, okay, in tummy. And some people like us, the top segment of the sacrum actually doesn't fuse. So in essence, we have a lumbarization, or that top segment that should be fused in the sacrum becomes the sixth vertebrae. It's called a normal variant because it's a variant from normal, but it's non-pathological. But what it does do is it creates a biomechanical environment where there's more movement, okay? Because we're supposed to only have 5 vertebrae. Now we have 6. So if you and I adhere to that model of, oh, the spine is designed to flex and bend and twist, so you should work it like that, well, people like us are going to break down. That's why the broad stroke of everybody should be on keto, everybody should be on carnivore, everybody should be a vegan, it doesn't work because we're all different.
Yeah.
Okay?
And I think it's important to note, and you've said this hundreds of times, that it's, so then you have all of this, that the way you move, and then that's why you're so particular about when it comes to exercise, ensuring that that's not another situation where you're hypermobile.
Because it's controllable. So this is what I tell everybody. You control your exercise by how you do your exercise and what moves you choose to do. I've been a little bit villainized by these people who use this stupid word called nocibic. It's the most trash word I've ever heard. Or kinesiophobic. Like, these are some of the messages I get. You're making people feel nocibic about movement. And what that means is afraid of movement or afraid of pain. And guess what? I'm not telling you to be afraid of the pain or afraid of the movement. I'm saying it's a dumb movement, like a burpee. If you, and I get that burpee video, it's still rolling. It's got almost 4 million views. That one video we did with Emma, our oldest daughter, back Christmas last year, it's sitting just under 80 million views, and I'm still seeing likes and comments on it. And that was a video of me saying, stop doing sit-ups. The one most recently with Jess, our videographer, was me saying to her, stop doing burpees. But tons of people are like, burpees are great. You should do burpees. It's a normal movement. Well, I'm here to tell you, It's a normal movement if you have very flexible hips. If you have 120 degrees of hip range of motion and you can squat down and keep your back in a good position, go down into the long high plank form of the bottom of the burpee, come back up into the low squat, which necessitates 120 degrees of hip range of motion, and then go up into the up phase of the burpee, you're good to go. Burpee the hell out of your life, okay? But here's the problem. 90% of the people I see clinically, and that is not an exaggeration, 90% do not have ample hip mobility to squat down. So I wish I had brought my spine model
they
here.
think they do, because I don't think people understand a proper squat to begin with.
So if this is the lower back, okay, here's your tailbone, here's your booty right here, here's your hips here, this is the lower back. If your lower back leaves this shape and you repeatedly flex it this way over and over and over again, we know that you will put strain on the structures. It's not going to get stronger, okay? It's going to break down the ligaments and the outer layer of the disc, and then that leads to what we call annular breakdown, which is the covering of the disc, and it will lead to bulges, okay? I don't care what people say. They can listen to this, go, oh, you're being nocebic again. If you have 120 degrees of hip mobility, do your burpees. But if you're telling people our age in a class like Orange Theory or whatever class, I don't even know because I don't do them. Okay, we're going to do burpees now for a minute, go. And you haven't checked those people for their hip mobility and taught them to do it properly, and you're just dropping them down and they're rounding their spine on the way down and then they're rounding their spine on the way up. You are breaking their backs down. Period, the end.
And it's not just that burpee. It is a combination of everything that we do that is hyper mobility for those segments. So it's
100%.
Just one more thing that you could easily stop doing.
Right.
Because you're not going to stop getting into your car. You're not going to stop some of these other things.
Absolutely.
And it's less that we're going to stop and think about how we're positioned in that situation. It's when you are exercising, that's a time where when there are other options that are healthier for your spine. I don't understand why people would not see that as a good thing, to know that this is an area where you see clinically problems with people with back pain because of that 100. And I can't even visualize for our people who are listening to this and couldn't see your demonstration there. You were just demonstrating hunching over or rounding your back. Imagine if you're, bending over to touch the ground.
And your spine is rounding.
Exactly.
So here's the interesting thing. There's research that shows people who have higher amounts of flexibility in their lower back, not in their hips, not in their hamstrings, but their lower back, okay, the lumbar spine. Those who have higher amounts of lower back flexibility often have higher risk of injury. So remember that. You want your lower back to be stable, okay? You don't want it to be flexible. You want other areas of the spine to be flexible. Now, why am I going down this rabbit hole? Because we flex a lot in everyday life, and we should, okay? Because we are designed to move that way some of the time. But if the majority of your life is spent in flexion, sitting with a rounded spine, which is most of the population now, as I peer over at Eric, our producer, who's slumping, looking at his phone. Now he sits up straight.
Mm-hmm. We all do.
But I digress.
No, I mean, it definitely is a legitimate point. It has gotten worse because we're sitting on our computers and we're looking hunched over on our phones.
Okay, how about this? How about a delivery driver? How about somebody who delivers soda or beer or food? They're in their truck all day long sitting. And then they get out of their truck and they go into the back and they bend over in these confined areas. UPS drivers this time of year, Amazon drivers this time of year, they're sitting in that rounded position, maybe trying to be upright, but I don't know. Okay, because I'll almost guarantee they're not taught how to sit properly in those chairs. They're given their keys and they're given their map and they're going, deliver this stuff, be back, don't come back until it's delivered.
Honey, there's nobody handing somebody a map anymore. That's on our phone.
You know what I'm saying. Okay. I had a job in 1988 doing that. But anyways, I literally had a map and a list. Go to these places.
Siri is telling
I just digressed.
Yeah.
I forgot my train of thought.
Sorry.
Oh, this is what I was saying. Okay, then they're going into the back of the truck in these confined places, bending over, stooping. I mean, I used to have a patient back in Kansas, and he specifically asked me to go. And technically, I wasn't allowed to be back there, but I won't name his name. He won't get in trouble. I went back and watched him move, and we changed his movement patterns because there's boxes everywhere, and he was having to get all bent over and flexed to get these boxes. Then he's picking them up. Then he's walking them and setting them down. He came in with a pretty bad disc issue. Had I not taught him how to move, he would have ended up with surgery. He would have ended up maybe disabled from the job. I don't know, but I fixed him up, showed him how to move. He didn't have any other problems. But let me finish this thought. If you have somebody who's doing that all day long and then they go, I want to get fit, and then they go to a class that includes burpees, this is what I'm talking about.
And I was just getting ready to say that it's compound movements all day. Like it's compounding each little thing that is putting more pressure on the disc, dysfunction on the disc, overflexion on the disc. Mm-hmm. And if there is a substitute for a burpee or a sit-up that is healthier for your back.
And there is.
Well, here's the deal. It is one of the number one Googled things is back pain.
Yeah.
So clearly we've got an issue.
100%.
And if everybody was being so nocibic or whatever, why would it be the most Googled problem?
No, it's hilarious.
Yeah.
And there's great substitutes. So, I mean, again, shameless plug for the app, but like if you want to work your core properly, go to the Hey Dr. Rob app and get the core program. Okay, we've got safe. I'm a back pain patient. Well, not anymore, but I used to be. So that's why I designed it this way. But here's the funny thing too is when you see people working out in the gym, like I was at the gym last night, in our little community, and it's got some older folks in it, and they kind of don't know a ton about fitness clearly, but God bless them, they're in trying. To a person, they always either start or finish with getting over on the little tilt abdominal board, and they do sit-ups or crunches or something that is kind of rounding them this way. Or they sit on that machine that does this crunching motion.
Or they go in the back hallway and get on a mat and do some crazy things.
Right. And the whole point is I know because I've asked a couple of them. When I say to them, you work in your core? No, I'm burning off my fat here.
Oh,
they
gosh.
all think they're spot reducing. Okay. But what they don't realize is they're not even getting close to spot reducing because there's no such thing as spot reducing. And they're trying to do these flexion-based movements to work off fat, but they're breaking their spine down.
Actually, I did see some new research on spot reducing. It's not impressive, but it is slight improvements, but not.
Sure, because you're getting a little localized metabolism, but come on, somebody wants to lose a bunch of weight.
That's not how it goes.
They got to hit cardio and eat better, and that's a whole different podcast. But anyways, the whole point is you have to move better because the whole thing about back pain is you can control it if you understand what it is and how to move. You can control it and you could stop it from happening. Number one, it's learning how to move better throughout the day, and I'll give some examples here in a second. But number two is don't exercise yourself into it. So backbreakers, okay? What's my number one backbreaker? You should know, being married to me for so long.
A Russian twist.
Well, it's number 2 or 3. Number 1 is the sit-up.
Oh.
Number 2 is the Russian twist. And then you have burpees and crunches and all these other things that get you on your back and flexing. And again, I get pushback. Okay, I got into
Where could everybody find those backbreakers?
You can get them in my book, Protect Your Back 101, which is on Amazon. And the cool thing about Protect Your Back 101, which I wrote back and started writing in 2015, published in 2018, it's all QR coded. So you can buy the book. There's a whole section on what not to do. And then the whole back of the book is basic, intermediate, and advanced safe core work that will crush your core and spare your spine. And it's all QR coded. So if you look at a move, you'll see a little QR code. put your phone on it, and it'll run for 10, 12 seconds.
Show you how to do
Show you how to do it. Or you can go to the app, get the program. It's $22 or something like that. And there's great workouts in there to work your core.
And I do believe on YouTube, if they even just go to the Hey Dr. Rob channel, is this correct?
I think it's listed as Dr. Rob Jones now.
Okay. So they can find backbreakers there.
Yeah, there's a backbreaker. There's tons of information in there, tons of substitutes. So number one, we know that if you can control how you move, you can control your episodes of back pain. So let's go back to the very beginning, because we've been talking mostly about what we call flexion-based back pain, okay, which is the type of back pain where you're bending over. So if this is your head up here, these are your feet down here, bending over like this with a rounded spine over and over again, and now adding load to it, like, you know, a 30-pound tote, carrying something, and bending over. The more you add load to it, the less time it takes to bulge a disc, herniate a disc, strain the back. Okay? So if you keep your back in this position and hinge back when you bend, I just did a post on Instagram a couple days ago. If you look back on my Instagram, there's tons of hinging. So if you're watching this or listening to this in the car and you're going, well, I don't know what a hinge is, just look back through my Instagram and you'll see tons of hip hinging. Hinging is keeping your back in a neutral position and pushing your butt back. I tell all my patients, I had a patient yesterday who I fixed up a couple weeks ago with a really bad disc bulge. She was getting ready to go to Oklahoma to help move a friend to Dallas, I think. And I said, when in doubt, and she yelled back, stick your butt out. And what that means is hip hinge. So if this is your butt right here, when in doubt, stick your butt out when you're bending. Push your butt back. The whole thing about, oh, I know, Dr. Rob, I should lift with my knees, right? Or lift with my legs. Well, it's a bad, whoever came up with that, it's not a good cue. Because if you lift with your knees or lift with your legs, you can bend your knees, but you can still round your spine. I don't care if you lift with your knees or not. You have to maintain a lumbar curve like this and then use your legs, okay?
You just kind of imagine a visual of your legs, not locked kneed, but just like a natural bend in the knee, and you're just literally bending at the waist and sticking your rear end back.
It's like a teeter-totter, right? So if this is the head, this is the feet, these are the hips. I'm standing up now. When I go to bend, my hips go back and my chest goes equal to it, just like that. It's very, very simple patterning. Again, tons of videos on all of my stuff about hip hinge patterning. So that's number one, okay? Hip hinge. Now, before I go on to the next type of back pain, if you watch all the best lifters in the world, Olympic lifters, power lifters, they wear those big heavy belts and they build intra-abdominal pressure, which is the hardening of the core, not a belly button drawback, because that's bad information as well. We'll get into that in a second. But they harden up their core and then they tighten up the belt and they push their core into the belt. Then they hinge to create maximum amount of power through their legs and their core and their upper back to do a deadlift or a squat or whatever. If they rounded their spine, the world deadlift record is over 1,000 pounds. I think it's Thor Bjornsson, Eddie Hall, one of those guys. These are the strongest men in the world in the last 5 years. If they rounded their spine, their spine would break down with that kind of weight. Now, there's some research that shows these really strong people, if they're a little rounded and they brace, the spine is protected to a certain degree. But I wouldn't recommend that for people, because most people, and I'm telling you, even people who are pretty fit that come in, most people don't understand true intra-abdominal pressure. If you don't understand true intra-abdominal pressure, you shouldn't be taking your spine out of a neutral position, because neutral and intra-abdominal pressure is the utmost of spine protection. Lordosis or hip hinging.
What's lordosis?
Lordosis is that. Sorry, I shouldn't.
A natural curve.
Natural curve. When we stand, we naturally go into this curve. When you see somebody with the big booty, that's called hyperlordosis. When you see somebody who's like really straight up and down, that's called hypolordosis. Not enough. Hyper, too much. Hypo, not enough. The sweet spot is just if you stand up and just squeeze your butt and then let it go and relax, that will get you into typically neutral, perfect lordosis mechanics. The best lifters in the world maintain that lordosis. They brace all the way around. They don't draw their belly button back. They brace all the way around, and then they push their hips back to bend, and then they come back up. Perfect hip hinge mechanics. If you don't want a bad back, if you want a strong back and be athletic, learn that.
Well, and I don't think anyone listening is a power lifter, but the
maybe
whole
they are.
point is if done properly, any amount of pressure or weight put on, if you are bracing properly and hip hinging, etc., it's protecting your back.
Yeah, absolutely.
So what I like to do, because when we work out together, you're always telling me to brace my core. And I always have to pretend that you're getting ready to punch me in the stomach, and that's how I tighten up.
Yeah.
So, or sneezing or coughing
or
or
clearing
something
your
like
throat,
that.
yeah. So-
because the old days of suck your belly button into the floor or, that whole thing that's bad.
Information. So that's still being taught. And again, I'm not trying to shit on anybody, but that's still being taught in Pilates classes. That's still being taught in barre, B-A-R-E, barre classes. I don't know what that is. But it's still being taught.
You did a bar class with me.
Yeah, but that was kind of like weightlifting, wasn't it?
No.
But yes. But I remember her saying, okay, tuck your tail.
Yeah.
Now do a squat. It's like, oh my God. So if you're in a barre class or a Pilates class and they say, okay, tuck your tail, you're getting into hypolordosis and you're creating an unstable environment for your spine. When you're lying on your back, let's say you're lying on your back, you don't want a hyper curve like this. You want a soft curve, just like that. And basically, if this is your legs down here, you basically want a soft curve. When that Pilates instructor or bar instructor says to you, okay, draw your belly button in and flatten your spine or imprint your spine to the ground, they're putting you in an unstable position. I've seen more broken down backs in women your age and a little bit younger from, I hate to say it, Pilates and yoga and bar classes. And it's not that they're bad. Their movement patterns are good. My sister is a Pilates instructor, and every time I go back to Toronto, we work out, and she does some cool stuff with me. But I've taught her about the not imprinting the back, and she's changed her ways and not drawing the belly button in. That destabilizes the spine. So when people are doing that, you got to remember, still go to your Pilates class or whatever, but I want you to remember, keep a little bit of a curve in your lower back.
And if they're saying, pull your belly button in, flatten your spine, that's when you brace your core.
Let's do an exercise. Okay, Eric, you're doing this too. Take your fingers, find your bottom rib, just like this. Drop your fingers down towards your hips, a couple of inches below your ribs. Dig your fingers in. Now cough. You see I think you can see this on camera.
It's almost like it's pushing out.
It's pushing outward. That's why power lifters wear belts around their midsection.
People think that's to suck their belly in.
No, they tie them up, cinch it down, and then they push
against
this
it.
way into it. Because if they suck back, that gets the transverse abdominis, which is this thin little muscle that barely stabilizes the spine. Now try this. Take your hands like this and this, put those fingers where they just were, and then put your thumbs on your lower back.
So right now for our listeners, our hands are on our hips here.
Yeah. So, you've got your hips like you're trying to strangle yourself. Now, what I want you to do is suck your belly button back, and you will feel nothing out of your thumbs, right? Okay. Now, keep your thumbs and fingers where they are. Now cough again. Do you feel your lower back puff out? That's called intra-abdominal pressure. That goes all the way around, and that's what holds your spine in place. So when you're doing your next Pilates class, or you're picking up that tote, or you're getting ready to hold your kid up to put the star on top of the Christmas tree, build intra-abdominal pressure. Don't let go of the intra-abdominal pressure until your kid is done putting the star up, you got him or her on the ground, or you've done putting the tote on the ground and you're standing back up.
And it takes practice.
Does take practice.
Yeah.
But the key to it is
think about it.
The more you do it and the more you think about it, the more it will become second nature.
Okay, let's take a break from the podcast to answer a couple of questions from our listeners. Are you ready?
Always.
What are the best core exercises? It's a pretty loaded question.
Yeah, loaded question. I could do a whole podcast on this, but I will say, and this is going to make the nocibic and kinesiophobic crowd angry, but you don't want to do backbreakers. You want to stay away from sit-ups, stay away from crunches, stay away from Russian twists, stay away from twisting movements. What you want to do is learn intra-abdominal pressure and then keep your spine stable while you're using intra-abdominal pressure with dying bug variations, bird dog variations, half side bridge variations, and Pallof press variations.
So where would somebody find more information on this?
All over the place. All over my page on Instagram at Hey Dr. Rob, heydrrob.com, my core training program. It's all in there. Safe core training. My book, Protect Your Back 101. It's all in there. There's literally dozens upon dozens of safe core exercises in my book that are graded from basic to intermediate to advanced.
Okay.
All right, your turn.
Okay.
Shannon, does eating 6 times per day make you less hungry than eating 3 times per day? I actually want to hear your answer on this.
Actually, there is a new study that, for my reasons, may be different from what they studied in the study, but it's the same outcome. The answer is eating 6 times a day does create more hunger. Mm-hmm. And there's a new study where they gave people the same percentage of macronutrients, the same calories per day. However, one group got 6 times a day spread out through 6 times a day, and the other one got 3 bigger meals. And the group that had the 6 times a day complained that they were more hungry in between.
Well, that makes perfect sense.
From a physiological standpoint, I am trying to help people maintain a good blood sugar control. Mm-hmm. And the more times you eat, the more chances you are giving your blood sugar to spike. Yeah. I would rather everybody learn how to properly balance a good balanced meal, feel fuller, faster for longer, not even think about food in between meals, and just eat 3 very nice, well-balanced meals a day, because we know that those breaks in between help better control blood sugar, give you time to digest, kind of just gives your system a break to get ready for the next meal. When you're doing 6 times a day, it's just constantly taxing your system. Mm-hmm. So it does equate, though, definitely to more hunger. And we note that people eat more calories eating 6 times a day as well.
Roger that. Good stuff. All right, back to the podcast. Now, the thing about intra-abdominal pressure that can be confusing is people will go, but I feel like I'm holding my breath. I'm not saying hold your breath, but what I want you to picture is you are watching Grey's Anatomy or one of those operating room shows, and there's a clear cylinder, okay? That's whatever breathing apparatus that is, okay? I want you to picture your torso as that clear cylinder. And then there's that little pump accordion inside that goes up and down. You with me?
Yeah, that's like when somebody's on a ventilator.
It's a ventilator, right?
Yeah.
So clear cylinder, pump going up and down. The cylinder is your core. Intra-abdominal pressure stiffens the cylinder. And then your diaphragm are these dome muscles up here that when they pull down, they draw down to allow the ribs to open and allow oxygen to rush in, get into and infuse the lungs. And then the diaphragm comes back up as you breathe out, and that pushes the air out. What you have to maintain, and this takes practice, is keeping the cylinder with tightness while you're breathing up and down. Do it while I always tell my patients, don't walk around like you're getting ready to punch in the stomach. It's a waste of energy. If you pick up something heavy, then you brace maximally. If you are picking up your suitcase as you're walking into your office, your suitcase weighs 10 pounds, great. Brace 10 to, I don't know, arbitrary numbers.
50, 75.
Yeah. Brace 10, 15, 20%. Meet the weight of the object with how much you need to brace. If you're carrying something heavy and it's pulling you over, like if you're doing yard work or something, you got a pail of dirt, or you're shoveling snow, it's heavy, and you go to pick it up and it's pulling you over, what you'll notice is if you create intra-abdominal pressure, brace your core, maybe 50, 60%, you're going to notice the load feels less heavy. Get rid of the load, and then you can relax the intra-abdominal pressure. So you have to grade it, basically. Does that make sense?
Yeah, it does. And I think, honestly, it's just about maybe until it becomes second nature, just stop and think about it.
Yeah.
And just take a minute to pause when you're doing something like this and check yourself on the abdominal pressure.
So when I was working with linemen back in the greater Kansas City area, we came up with a saying. It was before they picked anything up. Well, they were up on the pole before they had to grab something heavy. We'd say SOS. Stop, observe and assess what you have to do, then start the task. Okay? It's a second in your mind. I got to pick up that heavy object. What do I do? Brace, hip hinge, go. That's it. Very simple. Okay. It's not being nocibic. It's basically being smart about your spine.
Okay.
Okay? Can you tell them a little?
It's okay.
I feel a certain way about the nocibic comment.
Okay.
It's not nocibic.
Okay.
Okay, so really quick. We just spent 20, 25 minutes talking about a flexion-based injury situation. Flexion meaning bent over, not hip hinging, not doing intra-abdominal pressure, burpees, sit-ups, bending over improperly, and my back just went out. Okay? That's a flexion situation. If you want to fix that, it's very easy. Go to my YouTube channel, type in disc fix number 1, disc fix number 2 and 3, or my back just went out. Okay? Very easy. I also have protocols on heydrrob.com. You can buy the low back program. And I've got it categorized for a flexion-based bending over injury and then what we're getting ready to talk about. But the flexion-based bending over injury is very simple. You hurt yourself bending over, don't bend over to try to fix it. That's the mechanism of injury. Lie down on if your back goes out, lie down on your stomach. Rest on your forearms, kind of like how, a kid would lay there and play with a toy. Do some cobras. You're going in reverse of what caused the issue. Do some bird dogs. Walk, that sort of thing. Don't try to stretch it. Don't bend over and touch your toes because you feel tight. Don't lie on your back and pull your knees to your chest because you're rounding the spine in the position that caused the issue. With me? Mm-hmm. Okay.
I know this very well.
I know. I just want to make sure I got a little clinical there for a second because that's what I usually say to my patients. You with me? Because a lot of times people will gloss over. Does that make sense? You need me to repeat it. Don't lie on your back and pull your knees to your chest to stretch your back when it hurts because you're not fixing the problem. You're creating more of an issue.
And I think a lot of people want to go back to bed when that happens or lay on the couch.
Worst thing you can do.
Exactly.
Go for a walk. I tell everybody if you've hurt your back, bent over to do something, you need to go for a walk. You need to do these exercises and then walk as much as possible because when you walk, it automatically puts you into this good position. Okay? Okay, number 2. Number 2 is extension-based back pain. Okay? This is going to be a little harder to deal with. It's categorized a little bit differently based on a couple of situations. It's typically not a bending over issue. It's an overextending issue. Okay, so the people who are a little older will tend to have more of an extension-based issue. Okay, they'll have something called stenosis, where if I put them on their stomach and did this, it would worsen it. People who have something called a spondylolisthesis or a spondylolysis, those are extension flexion injuries, but extension will worsen. Somebody like, I have a lot of athletes that come in, volleyball players specifically, oftentimes have extension intolerance, and that's because when they go up to block, when they go up to hit, they get into this hyper-lordotic position. Do you remember me saying ideal? Okay, how do we get ideal? Stand up, squeeze your butt, let it go, you're ideal. Hyperlordosis is that big booty butt out situation, right? You can recognize it when you see it. Sway back is what some people call it, okay? Hypolordosis is flat back, different situation. If you have hyperlordosis and you have a lot of pain reaching up overhead, a lot of pain leaning back and your pain worsens with walking, that's usually the critical thing. If your pain worsens with walking and you can't make it a half a block or even down your driveway, this is more of a situation that's harder to get rid of. Usually happens when you're older or if you're a younger athlete. If you're a younger athlete, it's easy. I teach those folks to use intra-abdominal pressure. I find where neutral spine is, and then we do some dying bug exercises, some half side bridge exercises, teach them how to get up overhead. Like I had a college volleyball player that I helped back in July, right before she went to school on the East Coast. We got her up overhead. I had her doing these kind of heavy banded kind of slaps like she was blocking, teaching her to keep her ribs down in intra-abdominal pressure. 2 or 3 treatments, she was out of pain because she was defaulting into hyperextension. So the way to differentiate between these two is if walking relieves it, that's the first type you talked about. Yes. In most, there's exceptions, yes, but in most cases, yes. So the extension type is walking may make it feel worse. It may make it feel worse because remember, in the first one, we have a bending over type pain, right? So when you go for a walk, you normally get into kind of a good curve in your spine, and that relieves some of those disc symptoms. Now, people who are hyperextended, when they sit down, they feel better because they take the relief. So it's really just kind of the opposite. It's almost exactly opposite. And then when they go for a walk, they go back to that bad position. So imagine if I took my finger and really bent it back like that. If I continue to bend it back more, it's going to feel worse, right? So if I go like this and take some pressure off, that joint is now relieved. So with people who have that extension type back pain, especially if they're older and they have stenosis, what we have to do is I typically start them on their back. And they will almost always, I'll say, okay, brace their core, and they'll go like this. And they'll raise their chest up because they've been told to stand up straight. Mm-hmm. If you stand up straight and you pull your shoulder blades back, try it at home, and I want you to try it. Sit up straight and pull your shoulder blades back. Do you feel how there's pressure on your lower back right there? Yeah, it feels terrible. Yeah, it doesn't feel very good, right? So for somebody who's extension intolerant, they do this and they go, okay, my shoulder blade's back and I'm standing up straight, and then they take 3 steps and they're in a ton of pain. It's because when they pull their shoulder blades back, they go and they go back into this hyperextension. It's a terrible cue, and I hate to say it, some therapists are still giving that cue. What I tell all of them to do when they're walking is stand up. I would say squeeze your butt like somebody's trying to swipe a credit card. You're not going to let them. And that will almost always give them, it's just a cue. I'm not swiping a credit card between your cheeks. I know, but that's a pretty... Well, the reason I came up with that is because I had a patient back in Kansas. It was actually really funny. It was a guy I knew. His daughter was a volleyball player. A teenager brought her in. And he didn't like that when remember there was like a trend in the mid-2000s where these kids were showing their butt cracks in their jeans? I guess. Do you remember that? Okay. It was awful. It should not have been happening. But literally, like, girls would sit down on my table and this much butt crack would stick out. And this one guy would say to his daughter, hey, credit card. And she'd go, oh, sorry. And she would pull her pants up, meaning like he was going to swipe his credit card down her cheeks. It's pretty funny. I'm digressing big time. But if you have pain when you walk or you have pain in extension, stand up. Squeeze your butt really hard and then build some intra-abdominal pressure. Now what's going to happen is when you squeeze your butt, you're going to go out of this position and go into this position. So you have a softer curve. And then you're going to let your butt go after you've braced your core with intra-abdominal pressure. And that's going to hold your spine in a neutral position. And that's where you're going to walk from. And the pain almost always gets better. Now, what I usually do after that is I get them on their back and we do bridges and we do bird dogs and half side bridges to teach people how to contract their core and their glutes and use other parts of their body while they're maintaining intra-abdominal pressure to stay out of this chest up position, bring chest down. And again, it's a very simple fix, but you have to know what you're looking for. Again, in heydrrob.com, in the programs, we have extension intolerance programs, flexion intolerance programs. So if you've been diagnosed with stenosis, spondylolisthesis, facet arthropathy or arthritis, if you're over 70, then you probably need to get the extension program. If you have pain when you bend over, your back is super tight in the morning. You can't put your socks on. It's hard to put your pants on. Your back hurts when you cough or sneeze. You can't stand riding in the car for 20 to 30 minutes. It hurts to sit down on a couch, and it gets better when you walk and get out of your car. You mostly have a flexion issue or a disc issue. So those are your two categorizations. But
are those in your book as well?
Definitely in the book. Yeah. Both.
Okay.
The book is broken down in that exact way. If you have flexion intolerance, you do these exercises. If you have extension intolerance, you do these exercises. And if your back goes out, you do these exercises. It's if you understand, back pain is not hard to deal with if you understand it. Very few cases need shots. Very few cases need surgery. You have to classify what the type of back pain is and then deal with it accordingly. Sometimes adjustments help. Rarely it's a long-term effect. If you go to your chiropractor, and again, I am a chiropractor, so I'm not knocking chiros, but if you go to your chiropractor and you've been adjusted 25 times and you're not getting better, it's not the solution for you. Research is very unequivocal. I always get that word confused. I try to sound smart and I go right back to being dumb.
Well, it's
research is very unequivocal, or is it inequivocal? Unequivocal. Research is very strong on this one thing. Manual therapy with active therapy is one of the best things you can do for back pain. Manual therapy meaning adjustments, massage, acupuncture, that sort of thing, with active therapy, meaning the exercises I just talked about.
okay.
Passive therapies alone, medication alone, will almost never touch it.
Okay.
It'll give you a momentary glimpse of relief, but then you're going to be back to where you were. So
Okay.
do you want to wrap this up? You're giving me the okay, like you've been talking too much.
No. I feel like you've done a really good job.
Thanks, honey.
I have a couple of things to add.
I'm sick of talking. I'm not really. I never get sick of talking.
No, you sure don't. That would be a lie. Okay, so I have some supplements that are known to be good for people suffering from back pain.
Yeah.
And so what would be categorized as anti-inflammatory supplements is things like turmeric and curcumin, because it has that anti-inflammatory effect. When you pair the curcumin with pepper extract, that actually helps its absorption.
Okay.
Omega-3 fatty acids, which we've talked about a lot on this podcast, obviously fish oils. Then when we get to bone and joint health, we get into vitamin D supplementation, which I always recommend that's paired with a K2 for absorption. Magnesium is real important for bone density and strength.
As well as muscle tightness.
Exactly. I was going to say tension-related back pain. So that's 300 to 400 milligrams a day. As far as muscle relaxation, it's specifically magnesium glycinate, which is best for the relaxation.
Which you really want to take at night, right?
And prevent spasms and things of that sort.
You don't really want to take that in the morning because it's going to relax you too much and you may not be able to do your normal day.
Right. Then we've talked about collagen on this podcast, so we're talking more joint support now. 10 to 20 grams a day for connective tissue, cartilage, and spinal disc.
Okay. I was going to say not just joint protection, but like the disc itself is made up of ligamentous tissue that wraps around it. You have ligaments that are around the joints and they degrade. And again, we're not gnawing on bones and cartilage anymore. So collagen is something that I think everybody across the board should be taking.
Right.
Over the age of, 40.
Glucosamine and chondroitin, I think, this was real popular some time ago. I feel like it's kind of gone by the wayside. However, it still is proven to help joint health and reduce pain.
But you got to be on it long term.
Exactly.
That's the thing about glucosamine and chondroitin is in order to rebuild the matrix, and it's got to be sulfate, glucosamine, chondroitin, sulfate, because those are the bonds that we need to build the collagen. I think the data on it is like 5 years before you see any growth.
Got it. Then we can talk pain modulation. So the B complex vitamins are good for that. I always recommend a methylated B vitamin complex. That would be more like for a nerve compression injury, that type of thing. So those are supplements that I think could help with people who are suffering from back pains. There are ways to, like nutrition habits for back pain as well, and it really centers around the anti-inflammatory foods and anti-inflammatory lifestyle that we've always promoted in our Get Better Not Older protocol. So just as a reminder, berries in the fruit category, it would be berries, cherries, oranges, and grapes are very high in antioxidants. The vegetables are the leafy greens, broccoli, and peppers. Healthy fats are the avocados and olive oil, nuts, and seeds. And then if you go the whole grain route, I always like to go with our ancient grains, quinoa, oats, things of that sort.
You mean quinoa, right?
Nope. Then you're going to limit pro-inflammatory foods.
Yes.
We've talked a lot about that.
Which I can tell you without a doubt, and I've talked to a lot of patients about this, if I cheat, which I do often, not crazy amounts, but
don't.
No, I know, but during the holidays, I'll crush a whole box of Ferrero Rocher because it's my favorite thing. If I have 2 days over Christmas where I'm eating your mother's sheet cake and chocolate sheet cake and I'm eating Ferrero Rocher, I always feel worse for a couple days.
I haven't even mentioned what it is. So pro-inflammatory foods, the reason you're talking about said sheet cake and Ferrero Rochers is because they are very full of refined sugars.
Yes.
Trans fats, any processed foods, and then excessive alcohol. 'Tis the season to be jolly.
I want you to say pumpkin lolly lolly again.
No, that's okay.
Isn't there going to be a peppermint lolly lolly?
There will be a peppermint lolly law
Lolly. That's what it
at
was.
Starbucks here pretty
Peppermint
soon.
lolly law. I love it.
Okay. So those are pro-inflammatory foods that you would want to limit while in any type of pain.
Yeah.
So then on the bone and muscle health front, eggs, lean meats, fish, legumes, tofu. So we're talking good sources of protein to support muscle repair.
Tofu, though, making sure it's non-GMO tofu.
Yeah, I think that one would be worth organic, making sure. And then hydration, drinking plenty of water, making sure you're properly hydrated as far as spinal disc hydration.
Electrolytes as well.
Reduced stiffness. Spices and herbs. This can be wrapped into when you're talking about, trying to get plant foods in a day of diversity. Spices are a great way to increase diversity in your day. Specific to inflammatory or anti-inflammatory would be ginger, turmeric, garlic, and cayenne pepper. And then weight management, which is near and dear to my heart, is clearly when you maintain a healthy weight, it helps pain because of the pressure on the joints, etc.
Absolutely.
And that's really my contribution today.
Good contribution.
Okay.
Yes. I honestly, probably to my detriment over my career, I haven't really talked that much about supplementation with patients.
I gotcha.
Because I'm usually hyper focused. But honestly, because now I've been doing, really since we moved to Florida a couple of years ago, I was never really a big supplement guy. Take protein, a little creatine, Juice Plus.
Well,
right?
Here's the deal.
Now
we clearly want everybody to get it from their diets.
Yeah.
But there's a whole slew of issues with that, in that, remember the word supplement. It means I always call it the insurance policy. If you haven't quite got how you're supposed to be eating right, then it's your little insurance policy to bridge the gaps.
It's my what policy?
Insurance.
Insurance, not insurance. It's insurance.
That's enough. So anyway, I think we better wrap up for today. Hey, Dr. Rob.
Okay, we can do that.
But you did a very nice job talking all things back pain.
Thank you. Do I get to start in my notebook today?
We will list in the show notes. I think it's important, because I kind of listed off very quickly those supplements. So we will have those listed with some dosages in the show notes. I think it's important for people to understand, too, that precision dosing is important. In other words, if you are deficient just because the label says the serving is 1 capsule a day, doesn't mean that that's the dose you need to correct your deficiency. It also doesn't mean that it's the dose that you need to keep you out of pain. So having a good doctor or clinician who knows how to advise you on dose, precision dosing for your situation can make a big difference.
Absolutely.
Okay.
So direct any questions to the comments and we'll try to get to them as best we can. But I guess this wraps up episode lucky number 13, all about back pain. For my awesome wife, Shannon, I am Dr. Rob, and we will see you next time on the GBNO show, because I'm here to help you get better from the outside in.
And I'm here to help you from the inside out.
Get better, not older.